Hello, I'm Dr. Maury Markman from City of Hope, and today, in the next several segments of Minutes with Markman, I would like to briefly discuss the topic of measurements, and specifically as applied to the realm of oncology. Now, at this point, anyone listening to this discussion would likely say, why measurements? I mean, this has got to be a non-controversial topic. And in fact, in general, the answer to that is yes. And one must say right at the beginning, and I'll say later, measurements are absolutely crucial in many aspects of cancer care and research. But I would like to suggest, and hopefully this discussion will appropriately highlight, the need for what I've described as heightened awareness of both the process and tools of measurement as used in oncology, as well as the potential implications of what is being reported, what it means. So we start with the simplest measurements. Of course, one can include things like sex, age, and weight. These are all very important. They may be very relevant for multiple aspects of care. And again, in general, non-controversial. Then, of course, we have a variety of blood tests, CBC, liver function tests, serum glucose, renal function tests, etc., which of course are widely used and critically important in their value for multiple aspects of an individual's overall health and in specific clinical settings in oncology. For example, CBC in the diagnosis of acute leukemia or in the evaluation of the toxicity of anti-neoplastic agents. Again, all non-controversial. And of course, we have very specific measurements called biomarkers that are used in particular disease management oncology, such as the serum beta HCG or alpha fetoprotein, objectively measured, that are very useful in germ cell tumors, and of course, CA125, my own area of interest in ovarian cancer. Nothing controversial here, except perhaps with disagreements among experts in the optimal interpretation of the measured results in some of these, for example, biomarkers. But now we turn our attention to a different type of measurement and contrast the hard, objective measurements just highlighted versus what one may legitimately describe as expert-derived measurement tools designed to indirectly measure what has been classified or considered to be a valuable outcome. And I can think of no better example of the contrast between these two measurement aspects, hard objective data and expert-derived measurements, than what has been widely stated to be the two major goals of anti-neoplastic therapy. First, to improve overall survival, and secondly, to improve patient quality of life. And this will be the topic of the next segment of Minutes with Markman, and I thank you for your attention.